Hello guys, today is career day. So, our first career topic is going to be EMS. Why people should join EMS, what it is, and how to get it done. Trust me, being an EMT or a paramedic isn't for everyone. Alright? It can be a very rewarding job. Don't get me wrong, I personally love it, but I also don't get, a hard-on for running emergency anymore. It just happens. But I enjoy and love taking care of people. So therefore, still a great career choice for me. Other people, you might not like it, but it doesn't hurt to give it a shot. Maybe learn a little bit more about it. So we're going to start with basically what an EMT is and how to get certified. EMT, it's the basics of the basics. I mean, you start off, go to EMT school. It's about 6 to 12 weeks. I've heard of programs doing it in 4. Trust me, those programs are not easy. You learn the basics. You learn how to bandage, how to do CPR, stuff like that. You have to meet some certain requirements though, okay? We have standards in EMS. So, most places they'll require at least a GED, high school diploma. You gotta go through your training program. Trust me, for those of you that love medical, want to get out there, have a little bit of fast pace and something that changes every day, EMS, all day long. Super easy for you because you'll love it. If you don't love that stuff, you're gonna hate class. It's just that simple. You're gonna hate class. You're gonna be miserable on a truck, and it's just not gonna work out for you. All right. But after your class, you then go and take your national registry or your state exam, whichever your area requires. All right. Then, once you're done with all of that, guess what? You got your certification. Good job. Now you got to maintain it. Hours for CMEs, continuing medical education, they're going to vary state to state. All right. The national has their set, but it's not hard. Most agencies will give you the training for free once you get your card. All right. Maintaining is one of the easiest parts of this job. I've never had a lapse, never will. Don't ever let your national lapse, because once you do, it's not easy to get it back, all right? So don't let that happen. Even if you're planning on staying in your state your whole life, get your national, keep it up to date, and explore. There's plenty of other jobs out there besides just doing EMS on a box. You can go work fires. You can work the oil rigs. You can work on cruise ships, fishing vessels, all sorts of stuff. Factories will sometimes hire EMTs. Construction sites, EMTs. You're going to be needed in plenty of places. So if you love being an EMT, but you hate being on the ambulance, trust me, there's other avenues, all right? So now let's go over what exactly is an EMT. Like I said, it is the beginning step in EMS. You gotta have it to work on that ambulance, to continue helping people. You gotta have it. Everyone's required to get it if you work on an ambulance. I'm sorry, you can't be on the ambulance handing out the Band-Aids without an EMT cert. So, things that will be covered for your class and things you'll actually do. You'll perform CPR. You'll learn to use an AED properly, bandage wounds correctly, stabilize head and neck injuries, stabilize your broken bones, resuscitation of drowning victims. You'll provide oxygen to patients, perform emergency childbirth processes. I've delivered a kid or two. Not fun. Very big mess. Always deliver on their bed, not your stretcher. You'll go to regular old sick calls. You'll administer medications like naloxone, epinephrine. Albuterol, some places allow a few more, but not many more drugs. You'll spend your 6 to 12 weeks in your class. You'll learn all about it. You'll go over things like anatomy and physiology. Airway management, big one. You can't breathe, you're dead. All right, pay attention during that one for sure. You got your CPR and your automated external defibrillator, aka the AED. Your trauma assessments and treatments. Trauma does kill. Remember, don't waste time on scenes. I live by the 6-minute rule, not the 10-minute rule. On and off scenes for traumas, less than 6 minutes, because they need cold hard steel. They don't need a paramedic fumbling around with an IV. They don't need pain management right then and there. They can handle the pain until you get them in the back of that ambulance and those wheels are moving. Those patients need cold, hard steel and surgeons most of the time. You're not a surgeon. All you can do is add a little diesel. Get them there. All right. You'll go over medical emergencies, your cardiacs, your respiratories, your diabetics, your COPDers. You got so many things. Your appendicitis patients, all the way down to stub toes. Yes, we actually get called for stub toes. All right. Patient assessments and vitals. So basically, you'll go over your head to toe assessments. All right. You got your primary and your secondary. You'll get faster with them. Don't worry. Vitals. Hopefully they teach you how to do manual vitals. I hate when people don't know how to take a manual blood pressure. They're not hard. All you're doing is using your ears. These things right here. All right. We all got them. Use them. Listen. See. All right. You'll learn how to properly lift and move the patients. We deal with patients from like 6 pounds to 600 pounds, sometimes even bigger. Yes, those videos of the 1,000-pound sisters, they go in your ambulance. You need to be able to lift them with your partner and sometimes the fire department. Cops will sometimes help you out with lifting, but they usually have too much stuff on to even try. They can't get close enough to your stretcher. Then you'll go over your pharmacology, your medications, when to administer the meds you're allowed to administer, and also what general meds you'll see out there. Learn them. Live by them. Don't forget them. Then your EMT cert, it'll last you 2 to 3 years depending on where you're at. Some states are going to a 4-year cert, so there are those out there. Just understand that those come with tons of requirements to keep up. You gotta take your CPR. You gotta take your first aid classes. You have to get recerted on other things. You have to do your continuing medical education. And there's classes out there that are specifically for paramedics. There's classes out there that are specifically for EMTs. Take them all. Learn everything. Because in our job, the most important thing is knowledge. You can't fix what you don't know. Because you don't want to be that dude throwing spaghetti at a wall, hoping something sticks when your patient's dying on you. You don't want to be that dude on the wall throwing spaghetti at the wall when someone goes into labor. You need to learn it. You need to continue to learn it. And you need to continue to do better. All right? Biggest thing, if you have compassion of taking care of others, then this job is for you. 90% of our calls, all that is needed is someone to hold their hand and reassure them that everything is going to be okay. It's that simple. We're there because it is their darkest time. It doesn't matter if you think that stub toe isn't important. As an EMT, paramedic, firefighter, it all is going to require you to have compassion. All right? Be honest with your patients too. If you know someone is going to die, don't lie to them. Straight up tell them. Like, if you know their leg is busted up and they're going to need surgery, tell them. Warn them before you get to the trauma base. All right? being an EMT is honestly a very rewarding career. You get paid like crap sometimes. Sometimes you get paid great. Just depends on where you work and what your scope of practice is, all right? But you get plenty of benefits. You get to go home at the end of the day knowing you made a difference in someone else's life. It doesn't matter if you had a life save or you did nothing but transports back to the nursing home. You made a difference in that person's life. You made sure those people were taken care of to the best of your ability, and you'll feel better. You really will. If you still want to be in EMS, trust me, I fully support it. I think it's a great career. We work mostly 12s, 24s, 36s, 48s sometimes. I mean, it happens. We work a lot because we are very much in high demand. But you get stations, usually very nice stations, set up just like a house. You got your couches, your bedrooms, your kitchen with everything you need in it. But don't expect to be able to go shopping for your food when you get to work. Bring it with you, all right? And just remember, this is just a job. You're not a hero. Most BLS providers, when they first enter, will do nothing but transports. Deal with it. We all had to do it. It's not a punishment. It doesn't mean you're bad at your job. Doesn't mean we don't want you to advance to being an advanced EMT or a paramedic or critical care or community health. It means that that is what fits best in your scope of practice at that time inside of that system. All right, it happens. Some systems run just basics in paramedics. Some systems run an advanced and an EMT. Some run just double paramedics on emergency trucks. These things, like I said, vary very much. So, if you think you want to be in EMS, deal with those transports. You're going to do them no matter what your level is. Whether you're a paramedic or an EMT, you're going to do transports eventually. You're going to meet those salty guys that say, fuck this, I'm so tired, I don't want to do it. You're going to meet those guys that are actually really not meant to be in EMS and they are straight up assholes to everyone. But most people in EMS truly care. I'd say 99%. All right? We all got into this because we wanted to make a difference. You'll meet people with master's degrees. You'll meet people with bachelors. You'll meet people who got accepted into med programs and to PA schools and decided that they wanted to stay on a box. It happens. You're gonna meet some really smart people. And I think that it's because we bring both the adrenaline and the challenging mind frame. You can't be in this field if you're weak-hearted or weak in the head. Not saying we don't have great programs to help you if something does go wrong. Most jobs have free counseling, free therapy sessions. They will help you when you struggle. Everybody gets those bad calls where they need to talk to somebody. Even your saltiest paramedic at your job will sit down and talk to you if you're truly struggling with something. It's part of our job. We're there to make you a better provider. So if you're interested in becoming an EMT, ask yourself, is it something I can actually see myself doing? Can I lift 125 pounds? Can I walk all day? Can I sit in a truck all day? Can I lift a stretcher? Can I handle seeing blood and guts? Being around vomit, even touching feet. Yes, some people have some very moist feet and you have to touch them sometimes. All right, there's no getting around it. There's also times where you'll have to slap a tourniquet on because somebody just lost their leg. These things happen. These are the things that you need to be prepared for. Even during transports, you're gonna deal with patients that have, say, C. diff. They're gonna smell horrendous. And you're gonna put a smile on your face and say, "Hi ma'am, how's your day going?" Because you're bringing them home. Alright? It's just the way it is. So if you think you can be a compassionate human being, and you think that EMS is something you'll love to do, then come join us on an ambulance. We'll show you a good time.